because you see a spine specialist does not mean you're going to need to have surgery. Clearly, the studies also show that 40% of patients just with physical therapy can get significant relief and not need surgery. Many times we'll see conditions that may cause some discomfort, but aren't at the stage yet in which they require surgery. It may just require some monitoring with some time or medical therapy. This could be physical therapy, occupational therapy, pain management, electrical stimulation, things like that really do help people without full-on surgical services. It's important that someone sees a spine specialist when they start developing symptoms that need treatment. Okay, a lot of times people complain of pain in their shoulder or their arm or their neck or back, but really when you start developing things such as numbness or weakness, it's important that you get properly evaluated. We do that many times with physical exams, plain x-rays, and then even many times having to do an MRI scan of these areas.